Good morning, Mr. Jones. I wanted to discuss with you this morning about the information I received from doing your exam, the results. I want to go over with you hypertension and how hypertension can lead to further complications and what it is, etc. First of all, I don't know if you know for sure that hypertension or high blood pressure is basically a heart disease where your blood pressure, the systolic top number, is greater than 130, and the bottom number, the diastolic, is greater than 80. Primary hypertension affects about 95% of adults, and primary hypertension is hypertension that has no origin or no known origin or one that can be figured out. Secondary hypertension or secondary high blood pressure stems from something or an origin. There's a way to figure out, or there's a pinpoint of what's causing the hypertension or the high blood pressure, and it can be treated and resolved. And that affects about 5% of adults in the world. Um, and then there's complicated hypertension, or malignant hypertension, which leads to further complications or damage to the heart and other organs in the body, which over time can lead to organ failure. So that's something that we want to look at and try to deal with before it's a serious issue for you. Um, One of the things we look at are the risk factors for that can lead to hypertension, because right now you're pre-hypertensive, and you have a lot of risk factors in your medical history um, that can lead to having hypertension. Some of those risk factors are preventable, some of them are not. The non preventable risk factors are your age, your race, and genetics. And I see in your medical history, your mom and dad both had hypertension, and your mother also has type 2 diabetes, which is a comorbidity. Um, Hypertension or high blood pressure coupled with diabetes, they kind of exacerbate each other or they make each other worse. And so that's something, again, we would like to get a hold on. You do have other risk factors that are preventable, such as I know you have a high stress job, being a police officer in a tough neighborhood. There's not much we can do about the job other unless you want to change your job, and but there are things you can do to manage the diet. If you're not eating a well balanced diet, or you are not following a regimen of having a lot of fruits and vegetables, if you're consuming a lot of salt, not being physically active on a regular basis, if you're smoking, consuming a lot of alcohol, and I noticed that that is something that you reported, and those things are risk factors and kind of push you towards having hypertension. If usually hypertension, you're asymptomatic. Most people don't even know that they have chronic high blood pressure until they go to a doctor's appointment, or they get referred because they were being seen by another specialist for some other reason, or they have another underlying condition, so it sends them to the doctor. They find out they have high blood pressure, and then that's when they know. Most of the time, if people do discover they have high blood pressure from symptoms, it's because the blood pressure, the top number has went above 180, or the bottom number, diastolic, has went above 120. And those symptoms are dizziness. Those symptoms are fainting, nausea, vomiting, things of that nature. So you want to seek medical attention immediately, because that's a hypertensive crisis or emergency that you need to get help for. You don't want to pass out from that somewhere, because worse things can happen, obviously. So having that high blood pressure for a long period of time, as I mentioned before, can lead to organ damage, organ failure of other organs, such as renal insufficiency, or kidney failure, or kidney disease. As I stated with type 2 diabetes, kidney disease and hypertension, they kind of go hand in hand. They exacerbate each other. Kidneys filter the waste out of the blood. We urinate that out. And if your kidneys aren't perfusing or filtering properly, then you have that backup of the waste in the blood in the body that's not being perfused properly. and your heart is working harder, which increases your hypertension, which leads to further things like needing dialysis and things like that. And we don't want to further lead to those complications. And again, all of those put further work and pressure and damage on your other organs, and we don't want that. So there are some things we can do to prevent that from happening. Or at least reduce those risk factors. Some of those things would be your diet, changing your diet. Dash diet is something that people usually tend to work with. A lot of that is reducing or eliminating the amount of salt you consume. You want to eat more fruits and vegetables in your diet, trying to drink lots more water. You want to get more physically active and increasing your exercise more than just for like the training or things that you need to do. You want to try to consistently be exercising if you can. 30 minutes a day. Just trying to get on a regimen of doing regular, consistent exercise. You don't want to be sedentary. Um, you can also decrease the amount of alcohol that you're drinking, or eliminate altogether if you can, but reducing the amount of alcohol or how often you're drinking alcohol. If you're smoking cessation, definitely you want to stop smoking. Because those just poses all smoking creates more risk to other elements, and is something that exacerbates hypertension as well as other things like diabetes, etc. So you just want to be more mindful of those things. Behavioral change are one of those things you can do. As far as managing your stress, there are so many things that you can do to manage your stress: meditation, yoga. Some people say that they feel less stress from exercising. Maybe speak to someone as far as counseling or therapy, journaling, finding a hobby, different things that will allow you to relax and just focus on you and your mental health, can decrease the stress from your job. So those are some things you can look into. If you have any further questions or concerns, we can revisit this. But we're going to work on this plan to get this thing taken care of so that we don't further complicate or push you into hypertension. Thank you for coming, Mr. Jones. I appreciate talking to you and you listening. And we're going to get work done on a plan. Have a great day.